Hey everyone, Coach Cassandra with Kabuki Strength.
I am Dr. Francesca Vermillion with Healthy Living Chiropractic.
And today we're talking about pelvis and pelvic floor anatomy. So we're holding two models here. I just have the skeleton. So here we have the iliac crests, so our hip bones. We've got part of the lumbar spine and the sacrum, tailbone, and then an area here that I just like to mention called the pubic symphysis.
I'm going to go over the muscles and some of the internal anatomy here. So this is a pelvis with a uterus in here. So the uterus is in the front. We have the bladder and then the rectum. And so I'm going to remove these so we can see the muscles a little bit. And then inside, we have quite a few muscles that come across the inside of the pelvic bowl. And then we have more muscles that come here and attach to the spine. And then I'm going to turn. And from the bottom, looking up, we have quite a few more muscles. So the pelvic floor is quite broad, quite a few muscles that help support us and change quite a bit throughout pregnancy. I'm going to remove the internal organs so that we can get a better view of the pelvic floor muscles. There are multiple pelvic floor muscles with lots of fancy names to them. We don't need to worry about the exact names of them. But I'm going to talk about the most common one. But a lot of muscles combine together. The most common one is the levator ani in here. And from the bottom view, you can see it here. But it wraps around all of the external genitalia and really provides that pelvic floor support. And there are plenty of other muscles higher up that are also part of the pelvic floor and core muscles, and we'll take time to take a deeper dive into those in some future videos.
I always like to describe the pelvic floor muscles as a hammock. So if you think about here is just the empty skeleton, right? And then the pelvic floor would be right here, right in that bottom of the pelvic girdle. And so thinking about how much weight and pressure that those muscles hold is something really important and something to consider during pregnancy. So here I have the pelvis again, just showing the pelvic floor muscles. But now, how does that even connect with all the other muscles that we talk about when we mention the core?
Many of our core muscles are right around the area here. We don't have the muscles on this guy here, but we will talk about the muscles and where they attach. So we have the iliacus, which is a muscle right inside here and connects directly to the pelvic floor muscles and the hips. And then we have the psoas, which attaches to the lower lumbar spine. And comes around to the hip flexors. The transverse abdominis is one of our bigger abdominal muscles and attaches from the back of the ribs all the way around and makes this nice girdle. And then we've got the internal and external obliques, which stay on the side here, and the rectus muscle. The rectus muscle is one that we get concerned about during pregnancy. As it changes and stretches, we want to keep an eye on it. But all of these muscles work together to make a strong core, make a very anti-fragile foundation.
And then, of course, just referring back to the importance of breathing, we have the diaphragm that sits at the top here. And so the coordination of the diaphragm with the pelvic floor and then all the muscles that she just mentioned helps to provide the stability for low back and pelvic girdle, especially during all the changes during pregnancy.
I'm going to talk about the organs here. So we talked earlier, we have the rectum, the uterus, and the bladder here. So the uterus grows massively in size to accommodate for this growing child. So it will obviously put a lot of pressure down on the bladder. This is why many pregnant people have to run to the restroom, and it is common 8+ times a day and several times a night during the last trimester. These are common things. As well as why we might get some stress incontinence where we leak a little bit of urine at walking, normal day-to-day life. So these are things to just keep in mind and keep in touch with your practitioner about, and just let them know when it becomes problematic, and they will check in with you. As the uterus grows, it can also push backwards on the rectum. It can cause issues like constipation, or just cause pressure and issues. When you need to talk to your practitioner, when you just feel that constant pressure. So it's important to check in and see how things are going. And I'll let you talk about the organs, other organs.
Other considerations is that, again, there's already a lot of pressure that's going to be going down into the pelvic floor. She talked about the uterus and the bladder. But as the uterus grows, we can also get a little bit more, or we will get added pressure onto the vein and arteries. And so experiencing some lightheadedness is something that can get common, especially as you get bigger. And so when we talk about exercise, we want to make sure that if you're doing a lot of supine exercises on the floor or on a bench, or doing a bench press, you may experience that you need to make those exercise changes a little bit earlier. A lot of women are different, so just make sure that, one, you're getting cleared to exercise by your provider, and two, you are communicating with your coach if you are getting lightheadedness or dizziness during exercise. Another thing to keep in mind is that there are a lot of nerves that run through the low back. So as the pressure gets heavier and as baby is moving more often, you may experience some sciatica. You may notice some sharp nerve pain that comes here and there. It may be a one-off thing or something that is continually bothering you during pregnancy. So that's another thing. If it's starting to bother you and become a problem and limit your day-to-day, or especially with exercise, definitely bring it up with your provider.
Other changes that happen to the pelvic region are we get the hormone relaxin releases through the system, and that's so that the body can grow and stretch to accommodate a growing healthy child. The relaxin is a very common hormone, and it gets higher and higher towards the end of pregnancy. This causes these ligaments to loosen a little bit, but the important thing to remember is you're not fragile. You still can be strong and work out. But these ligaments back here, they'll start to stretch. Not everyone experiences pain with this, and some do. So it's really important to keep in contact with your coach and your provider about what pain you do experience back here, or even in the front, in the pubic region. These areas can stretch too, and your coach can help make accommodations to your workout program from there.
And I'm Serena Engel. I'm a physical therapist and pelvic floor therapist.
During pregnancy, it's expected for a lot of changes to occur to your body. Even though it's going to seem like 10 months is a long time, that's a short period of time for your body to go through a lot of changes hormonally and physically. Because of the hormone relaxin, your body is actually trying to create more mobility through the pelvis to prepare for birth. As a result, sometimes people start to feel a little discomfort in their pelvis. And so that discomfort can be anywhere from the front right and through here. If we can turn it here, some people have some generalized low back pain, just center through the spine. Some people may have pain in both SI joints, or one or the other. They may even have some tailbone pain. And so when we're training, we want to consider those feelings that you're having and adjust accordingly.
And I just want to play off of that a little bit and give you guys some appreciation for how many ligamentous structures that we have in that area. So all of these blue guys right here are all ligaments, and they're very, very thick ligaments. They all overlap over top of each other, but they are all relaxing, expanding, and trying to make room for the baby. And especially when you're going through childbirth, everything in there widens, especially this little piece of cartilage here. So these joints are held together by these ligaments and then cartilage over top of them. So everything in this area is supposed to be mobile on purpose for the purpose of pregnancy and carrying a child. But because they are not as tight as normal, that can create a lot of discomfort and pain.
So going back to the topic of breathing and optimal pelvic floor and abdominal function, all of those muscles act to help support the pelvis. And that's even with someone who's not pregnant. So now you add the factor of added weight and pressure going into the pelvis during pregnancy, add the hormonal changes that are happening and the different weight shifting that's happening. We really want to emphasize the importance of having that connection breath and being able to support the changes that are happening to our musculoskeletal system. So during training, if you are experiencing some discomfort in any of the areas that I pointed out, one, you always consider going to a pelvic floor physical therapist to address any individualized needs that you may have. Or again, always going back to how much load and how much volume are you adding into your training, and can you make sure that you're focusing on that breath with every single rep and making sure that you're giving your body the support it needs while you're training.
And just giving you some cues for when you're going to have those talks with your trainers or physical therapists or physicians. When you're thinking about the types of pain that you're going to experience, all of these structures here, ligaments, muscles, you might even experience a little nerve pain. Those should be fairly dull pains. If you're feeling like a frequency that is not tolerable for you and it's sharper, that should probably be medically addressed, and you want to go follow up with first your physician, and then they will take it from there and see where you need to go. But that is something that you want to keep an eye on.
And today we are talking about the importance of breathing and the deep core system, especially when we're considering training during pregnancy.
So when we're thinking about breathing and breathing dynamics when you're going through pregnancy and when you're weightlifting, we're going to start off with a foundation of anatomy so you know what we're talking about. So I have my pelvis here, and everything that is structured in your deep core system is structured around the pelvis. So in the bottom we have our pelvic floor. Those are our muscle groups. On top of the muscle groups is going to be your bladder and your baby. And then above that is going to be your diaphragm. And the diaphragm moves up and down while you're taking breaths in and out. And then around the pelvis in this situation is going to be your transversus abdominis and your erector spinae muscles, multifidi muscles. So all of those muscles are a part of your deep core system, just those 4 categories there. And they're what we're going to be referring to throughout the video.
The anatomy is important to consider because oftentimes when people think of core considerations, whether it be when you're pregnant or not pregnant, they think of the superficial rectus abdominis muscles, and we're thinking about how to strengthen just the superficial anterior musculature. But we want to make sure that when we are referring to core, we're thinking 360 degrees around the trunk and top and bottom.
To play off of what Cassie just said, I'm going to demonstrate for you what's happening when you're breathing. So now that we have our background with the deep core system, we know that when you're breathing in, we're pushing our core system down, which is why when you take a deep breath in through your belly, and we call it belly breathing, our belly pops out forward. So if I take a belly breath in like this, and pushing out, and then back in, and as you go in, your abdominals are contracting, and it's a deep abdominal contraction. So like Cassandra said, it's not going to be your superficial muscles that are doing all the work. It's deep to that in through here that are connecting to the pelvis. So when you're breathing in, you want to picture everything is lowering together and relaxing. So your diaphragm is working to push the air and to push downward, create more space for your lungs to create some air in there. And then your pelvic floor is relaxing. When you take a breath out, your abdominals are going to contract, diaphragm comes up, pelvic floor also raises. So that's the visualization that you want to have in mind when we're going through that. The dynamic does change quite a bit when we're considering pregnancy. So when we're talking about the airflow during pregnancy, we have a lot more pushing in this pressure system. So your regular pressure system is already going to be a little bit like this, right? Because you've got something pressing down on your pelvic floor already, the baby that you're holding.
So now we're gonna go over some demonstrations. I'm gonna show you what that breathing looks like on my pregnant belly, and then we will demonstrate on Serena, right? So one thing to consider between a pregnant body is that my rib cage is naturally going to have to expand because of what's happening through here. So my dynamics are gonna be a little bit different.
Right, so as Cassandra's ribs are splaying out, and normal ribs are just right in here. So when we talk about breathing, normally I'm encouraging patients to do a belly breath, but here it would not be appropriate because she's gonna fail immediately. She can't really do a belly breath, so she's gotta get her air from in the sides of the ribs here. And after pregnancy, you have to go through some breathing exercises to actually undo that. Your ribs are still going to run and recruit a lot, and we can do it even now. I can contract all of those muscles and expand my ribs quite a bit, but that's not where you want to get your breathing from because there's no abdominal use in here whatsoever. And during pregnancy, that's okay because we don't want to use abdominals. They're just relaxing, they're creating space, your body's working on other things. When you come out of pregnancy, you want to start engaging your core again, and that's where the breath work is going to come into play.
So a great cue to think about, regardless of pregnancy or not, you want to still think about creating 360-degree expansion through the trunk. For me, because there's only room for me to move through here, I'm still placing my hands here for tactile cue. And notice that when I'm taking a breath, even though it's not a classic belly breath, you can still see that I'm moving horizontally and not up into my chest. And it is going to be natural to feel like I can't take a big breath just because there's not a lot of room for my diaphragm to push down. So still focusing on the intent of breathing low into my rib cage and creating that 360-degree expansion. Same thing with Serena when she's breathing. Even though she's focusing a little bit more on feeling that lower, it's still going to be a cue of 360-degree expansion through the trunk.
Yes, and normal breathing is going to have the breathing expansion all throughout here. Just during pregnancy, it's going to come a little bit higher. But your pelvic floor is still engaging regardless of pregnancy or not pregnancy. It's still a part of it, so don't forget it.
Now we are demonstrating 2 breathing exercises. So I have Serena here laying supine on her back, and we're going to go over the connection breath. You can refer back to our video on the core and the diaphragm and the deep stabilizing system to refer back to what we're talking about in terms of the anatomy. But in this exercise, we're going to teach you how to coordinate the diaphragm with the pelvic floor. So I refer to this exercise as the connection breath. Many courses you may take may also refer to it as a connection breath. So we are connecting diaphragm with pelvic floor. So I'm going to have Serena place her hands on her abdomen here just for tactile cues. So as she takes a breath, what we're wanting to see and what we're wanting her to feel is expansion through the abdomen. She may not necessarily feel that diaphragm drawing down, but we can see that happening if we're seeing that 360-degree expansion around her trunk. What we want is the diaphragm to draw down, and as a result, the pelvic floor will also draw down. So what is this going to feel like? As she takes a breath, she's going to breathe in here, and the cue that I'm going to provide my clients to feel their pelvic floor sinking with that diaphragm is imagine like you're trying to fill that pelvic floor. And as you fill the pelvic floor, you should feel it drawing downwards. As she exhales, the diaphragm is going to come back up, and her pelvic floor is also going to draw up. So if we bring the balloon back as an analogy, as she takes a breath, so go ahead and take a breath, that diaphragm pushes down into the balloon, and the balloon will fill my hand here. When she exhales, the diaphragm is going to come back up. And now I'm going to draw up the bottom position, right? So diaphragm, pelvic floor. She's going to take a breath, diaphragm draws down, and the balloon fills my hand. As she exhales, diaphragm goes back up, and my pelvic floor draws up.
All right, so this next exercise that we're going to go over is some star breathing. So if you're worried about diastasis recti after pregnancy, star breathing is a really great place to start off with, just to pull everything a little tighter in that fascia. So I'm going to have Cassandra demonstrate for you where our star is located, with the center of the star being at the navel. So that is her center. And then if you can picture, the bottoms of the star are going to be on either side of that pelvic floor, right around the hips. The sides of the star are going to be around the sides by your ribs, and the top of the star is going to be coming from your chest and your upper ribs. So as you're breathing inward, our star is expanding, right? And as you're breathing out, our star is coming in. Everything from your star is coming in, and it's going to come right back to the navel. So you basically want to imagine your whole abdomen is contracting inward at the navel. That's where you're pulling that from.
Now, this is not to be confused with sucking the navel in to create tension through the abdomen. Note that she mentioned that it's all drawing back to the navel, so it's still trying to focus on what's happening throughout all the abdominal muscles in the trunk. And we're not just focusing on sucking navel in and out. It's everything expanding around the navel and then back towards the navel. As you go throughout your pregnancy, many apps and books will probably talk about the urgency to have to urinate, as a lot of the contents in your abdomen get squished. Now, what happens when you leak, especially when you're starting to train? What do we consider, and where do we focus our attention when that happens?
Okay, so we're going to start off with a visual here, just so that you can gain a better understanding of what your coaches are going to be telling you all throughout your training. So I usually use a soda can to represent the pressure system of the deep core. So like we demonstrated with that balloon, this is the same concept. It's just a little more easy to understand when we're talking about leakage. So the soda can is filled with pressure right now, just as your pressure system is going to be filled with pressure from air. So if we release the pressure in the soda can, we want the air to come out of the top, like when we're opening a soda can. We don't want the air to come out of the bottom, because if it comes out of the bottom, we're going to have a leak. Okay, same thing happens when you're training. So when you're training, you want to think about your breath as being the top of the soda can.
I'm going to go over the common areas that you will feel pain in the pelvic girdle. Research, unfortunately, does not separate low back pain from pelvic pain, so it can be lumped all into one. So sometimes this low back pain we can feel, and it might radiate down into the SI region or further into the buttocks. We can also get pain along the sacroiliac joints. This is in part due to the relaxin in the system, causing a little bit of the expansion and stretching, and some of it is just the additional weight that we have of the growing child pushing down on the pelvic bowl. But it's very common to get the pain back here. Also in the front, in the pubic symphysis, you can feel that with walking or standing on one leg. And then you can even get pain into the hips here, and then not on this model, but we also can get pain into the lower ribs as the abdomen expands.
Not everyone will experience pelvic girdle pain that may stop them from doing the things that they want to do. But because it is a natural thing for relaxin to be flowing through a pregnant woman's body, and for a lot of weight for that pelvis to be carrying as pregnancy goes on, we still want to talk about it and just know what to do when you start to feel some discomfort there, especially during activities and during exercise. So the pelvic girdle pain, first off, a few things that we want to make sure that you want to be in tune with during exercise is any heaviness in the pelvis. So if you are lifting weights and you're pushing more pressure into into the pelvis, and you're feeling a constant heaviness into the pelvic floor, especially after you lift weights and you're resting and then you continue to walk around and still feel that heaviness, probably a sign that you should back off the intensity. We also want to look out for an increase in contractions. Now, you may be experiencing Braxton Hicks, but we want to make sure, again, that the exercise isn't making things worse or making those contractions prolonged. You may feel it, but those contractions should decrease with change in movement and should only last for a few seconds. And so if you are experiencing contractions, again, make sure that you speak to your provider or your coach to make sure that you are making modifications. Now, in terms of pelvic girdle pain, exercise again should make you feel better, not worse. So if you're starting to feel more pain, whether it be in the front, on the sides, maybe in your hips, your low back, tailbone, more specific exercises is going to be more appropriate coming from a pelvic floor PT or specialist. So make sure that you reach out to your pelvic floor therapist. But in terms of exercise, speak to your coach so then that way they can make some modifications in your program, whether it be intensity or type of exercise, to make sure that it is decreasing those symptoms. Referencing back to another video that we have filmed, we talk about RPE and just what you should be feeling during exercise. So again, remember, we're not aiming for breathlessness at this phase of pregnancy. We're also not looking to, max out in our lifts. I like to tell people to aim around RPE 7, always bringing it back to that connection breath and making sure that you can maintain quality of diaphragmatic breathing just to support the changes in the pelvic floor and still keep that coordination of all the abdominal muscles working together to move you through your exercises.
The goal is not to still stick in the no pain, no gain phase. You're taking it easier, and so it's more about train, not strain.
We're just going to show you a few of our favorite exercises that we like, whether it be for mobility, whether it be to prep during your exercises. Maybe you just want to get some good exercises throughout the day, and it's going to be focused on core and muscles around the pelvis and hips.
Great. So we're going to get Cass set up here. And this is the fun part. So just to get the back of the pelvis moving, it's a great mobility one. I'll show it, but just in general, some people have concerns about pregnant people laying on their back. The real concern for people would be if you get any lightheadedness, shortness of breath, dizziness, and most of these exercises are very short, so they're not going to cause those issues. And even at the end of pregnancy, the concerns of the weight of the baby crushing the aorta is only 12% or less, so it's generally very safe to be here. But the first one we're going to do for a little bit of sacroiliac mobility is just a one knee hug to the chest. So Cass will pull one knee into her chest. She can push a little bit through the heel here and hold, and then alternate. Bring the other knee up and push. And what's really normal here is sometimes there might be some popping, cracking, and that is totally normal. The relaxant in our system will allow our joints to move a little more easily. As long as it pops and there's no pain, it's totally acceptable. Great job. The next one, we'll be doing some bridges and either a yoga ball, a little mini ball, or a rolled towel. You'll just put it between the knees here and squeeze. Because of the relaxin in our system, as you roll side to side, you want to start practicing squeezing those knees together, and that will make it easier on the back when you're rolling. Now this will be a bridge up where Cass is going to push through and squeeze at the same time. And just do a few of these, and it goes really well.
And I like to coach my clients to just sync their breathing and bracing with this exercise. So I'm going to engage core, or I'm going to take a breath in. And as I come up, I'm going to blow my air out, engage core, and squeeze adductors. It's going to help engage diaphragm, pelvic floor together, and also just making sure that I am breathing and I'm not holding my breath during this exercise.
One thing you'll want to watch out for is if there is any, near the end of pregnancy, we will see some of the diastasis recti, and that's where the linea albia stretches, and it's normal for this to happen. But what we want to avoid is any coning or any of the stretching beyond about 2/3 of an inch. If you see this popping in basic exercises, talk to your provider about it. Just so that you can make sure you're safe, talk to your coach about it so things can be modified.
And speaking of the coning, so some of your core exercises may not be very appropriate at certain stages of pregnancy because of coning that's happening. So you want to make sure that you're finding the exercise that allows you to maintain good coordination between your breath, pelvic floor, and core muscles. Since lying on my back can get uncomfortable at this stage, and even a few months ago during my pregnancy, I started experiencing coning when I was doing just basic exercises like like a dead bug and planks. But I found that when I transitioned to a bird dog, I was able to control that a little bit better. So again, it's going to be different for every single person. Speak to your provider, speak to your pelvic floor specialist, and speak to your coach on which exercises need to be individualized for you. But one of my favorites is just a basic bird dog. So over here, Francesca will coach me through it.
Yes, I am gonna, usually if people are new to this, I have them start with just one arm. You'll reach it out in front of you as far as you can. You can either make a fist and practice punching the wall or just stretch out with your fingertips, whatever's more comfortable, and then switch to the other arm. You'll hold for a few seconds and then return. Another modification in pregnancy is that you can just sweep your foot along the floor instead of lift, but go ahead and bring a leg back. But that's one that you could do instead of a full lift, and that allows better control through the abdomen, and then switch the leg. Sweep the floor. Excellent. And then if you feel ready, you can coordinate opposite arm and opposite leg. And the focus is just to stay straight and flat through here, and then alternate. And if you feel comfortable, you can lift the leg, or if you're not comfortable, you sweep the floor. Anything else you'd like to add, Cass?
Just notice that I'm going nice and slow in between each rep, taking my time. I'm not trying to just go through the reps. I'm making sure that I'm staying nice and tight through my core while still breathing through it. So I'm not holding my breath. No Valsalva maneuver, even though it is challenging to my core, I'm still 100% in control of how much I am straining, and it shouldn't be. This next one, a lot of people refer to as happy baby. It's just a great way to just get some good relief through mid-back and sacrum, just getting some gentle mobility. So early on in pregnancy, you can grab onto toes and just practice that gentle rocking. Doesn't have to be anything crazy. But as you start to get bigger in pregnancy, for example, I wouldn't be able to reach my toes right now, but you can grab underneath the knees here and still do the same thing. And just rocking pelvis side to side.
During pregnancy, as the body expands, these ribs will widen and flare here. And that can cause a lot of issues. It can be sharpness with breathing. It can also cause pain around in the front underneath the sternum here. So we're going to show a great mobility that just helps stretch the area out, keep it moving, keep it feeling good. So Cass is going to reach with her arm, reach underneath just to stretch this area here, and then she'll twist the opposite way and open it up. And again, through these, it's very common to feel popping and stretching. As long as there's no pain with that pop, it's perfectly safe. Anything else you want to add?
As you can see, I'm not going very far, but I'm not necessarily trying to just go to my max distance as far as flexibility goes. All I'm doing is just getting some good movement through thoracic spine and ribs, syncing my breath with each movement.
Next topic is going to be diastasis recti. So this is a very common topic when we're talking about postpartum, particularly during pregnancy, not really a consideration that you need to worry about. So the word diastasis meaning separation, right? So when we're thinking about going through pregnancy, we expect to see a separation. Separation is normal in order to make room. So as you see on Cassandra, she's got probably 4mm separation there, just at the navel. It's going to especially be around the navel when we're thinking about the diastasis recti. So people also call them around the umbilical area. So it's just in this region that we're focusing on. But obviously during pregnancy, it's going to rise up and lower.
This is also why we focus so much on the connection breath, because we're not just talking about the rectus abdominis muscles here. If we are always focusing on trying to crunch and create pressure through the superficial muscles, it's going to be very difficult because, again, the rectus abdominis, or the six-pack ab muscles, are naturally already separating. And so we're not trying to bring them back together during pregnancy, but what we are trying to avoid is further weakening of the deeper muscular system that rests underneath the superficial rectus abdominis.
So a diastasis recti is going to happen along the fascia that's connecting the rectus abdominis. So the rectus abdominis, as Cassandra said, is your six-pack muscles. And the linea alba is the name of the fascia that connects them. So some people call that a line of definition separating your abdomen. That's where we're looking at. Again, as I said earlier, the main focus is going to be around the umbilical region. And some people, this can happen in males and females. And some people do get an umbilical hernia with this. So that is why we really want to teach you how to do a pre and post assessment. Because this is something that if it lingers after pregnancy, you do need to get treated to avoid that hernia. So when we're thinking about the diastasis recti, we want to consider your anatomy. So as Cassandra said, the rectus abdominis is the six-pack abs that are superficial. And then the fascia holding them together is where we're looking for a separation. So this is the line of definition here. It's also called the linea alba. That's what's connecting everything, and that's what's separating naturally during pregnancy. So the ideal way to assess yourself for diastasis recti, and I recommend every single woman going through pregnancy does this assessment, is to do a pre and a post assessment. So the pre-assessment is going to happen either when you know that you're trying for a baby or in the beginning of your first trimester. You're just going to palpate along the linea alba for that. And then the post-assessment, give yourself some time. Do not do any assessments of any kind after giving birth. Give yourself, at least 8 weeks before you go into this assessment. And I wouldn't even do it that soon. But let your body heal from that. So just as long as you took to create that life inside of you, you want to give yourself that much time to kind of feel back to normal. At least give it 8 weeks, so a couple of months before you're starting to assess this. So before we go into demonstrating an assessment, I'm going to talk to you about what you're going to feel and what we're looking for so that we can do the assessment pretty quickly. So as you're going through, we're looking at a 2-finger separation. That's a normal separation. You can have a 1-finger separation. You don't want anything over 2 fingers though. Anything more than that, especially if we're looking in the 3 region or a 4, too much, that's when we're gonna start getting treatment. Anything over 2 fingers, even if we have 2.5, okay? So when you're going through the linea alba and feeling for that, the main area of focus is gonna be around the umbilicus, and then we're gonna go under and above, okay? As you're going through pregnancy, as we said before, the separation does occur above here, but these are our main areas of focus that's going to show up the most. When you're feeling for your fascia, you're going to be feeling for the quality of the fascia. So a lot of diastasis recti is considered hereditary. So you need to assess this on yourself beforehand so that you know the quality of the fascia. And a lot of times you can be more aware of this if your mother or father has reported that they've had this happen, because you can have this in males and females. So that is something to ask your family members. But when you're feeling for the quality of the fascia, you want to take 2 fingers and go down the line of definition, and you're going to press in, and you're feeling for how squishy the fascia is. So if you're feeling and you feel a little bit more of a thinner, squishier fascia, you're going to be more prone to developing diastasis recti than somebody that's got a really thick, firm fascia. Ideally, that's what we feel when we do this self-assessment, but whatever you feel is what you're working with. So let's get started on the assessment. So doing a home assessment. So we're going to take 2 fingers and go downward, starting up here so that you can get a feel for it. You're going to do a little crunch. So I'm going to go into a little crunch here and just go down. And right here is where you're going to start to actually feel your fascia and feel if it has any squish. Okay? So we want to go down a little bit further, right to about here, and then we're done. Okay? So you want to be able to see the distance that your fingers are traveling at as well. That's going to be important, especially for your post-assessment. So if your fingers are traveling and they keep going down, that's probably an indicator that we need some work in that area. And you may benefit from some pelvic floor PT, or at least to start working that in some way. But you do need to be careful in how you're working it if you have a diastasis. This isn't something that we self-treat because, like I said earlier, it does develop into an umbilical hernia. Okay, so we're going to go into an assessment. I'm going to go into a crunch and put my fingers down like this. And I'm feeling nice firm fascia, a little bit squishier down through here. And I only feel about 1 finger when I'm doing this. So I've got my 2 fingers here as I'm working my way down. But I really am only feeling it in this finger, so I know I've got 1 finger. The other good indicator for feeling if your fascia is nice and firm is it should feel like the tip of your nose. So before you do the assessment, you can do a little assessment here and then go through and feel and see if that feels similar or not.
We did a video on diastasis recti, and we talked about what that is and how during pregnancy we're not necessarily trying to avoid it because of the natural separation that's going to happen as you grow. However, one of the things that we are looking out for during exercise is something called coning. So coning occurs when you are doing a lot of different core exercises or even just some body weight exercises or straining as you're lifting or doing certain exercises. And when that happens, you're going to see the middle part of your abdomen start poking out. And so, I've seen this with clients, like when maybe they're trying to do pull-ups, and just because of how much they're engaging their core, we really start to see a little poking through that middle portion of where the abs are separating. Some people may see this if they're doing a crunch, even trying to do some core exercises that I personally like to program a lot, like a dead bug. They may look down and suddenly they see some coning starting to occur in the middle. Now, when you see that, don't freak out right away. However, it is just a sign to probably scale back and really focusing on not straining and trying to engage those core muscles as hard as that exercise is demanding. When we're working on different types of exercises, making sure that you're focusing on those deep core muscles, those muscles underneath the rectus abdominis, again, syncing it with your breath, should help decrease the coning that can naturally happen when you just strain and push through that softer area of the separation that's occurring.
So coning is going to be your indicator that you are doing too much. So either whether it's during your first trimester, when you're doing a dead bug, if you notice it, not a good exercise anymore. Go ahead and take that out of the program. If you're postpartum and you're doing an exercise and you notice that, okay, not too much. Go ahead and scale it back, take it down a few notches, and work on just engaging your core with something simple like that STAR exercise.
We're going to provide you with some general exercise guidelines. For lifting, generally, I like to advise clients to pick an exercise that they can do higher rep ranges. So around at least 8 reps, 10 reps, even up to 15. This allows them to make sure that they're not loading too heavy, because most people aren't going to be lifting 80% or higher in that high of a rep range. This is also going to allow them to be intentional with their breathing and their connection breath, making sure that they're not working towards an intensity that is putting them in a Valsalva maneuver. As far as rate of perceived exertion, around a 7 is probably the highest that I would recommend. Again, just making sure that you're able to modify as needed in the moment and trying to avoid Valsalva, also high intensity stuff that may cause coning and you may not be noticing it, or even putting just more pressure on the pelvis than needed, or trying to push through pain. At this point during pregnancy, your body's already going through a lot and major changes. And so when we're talking about what you're trying to gain out of your exercise, we want it to be something that makes you feel good. And so if you're working at an intensity just because that's what you were doing before, we don't necessarily want you to come out of that exercise with more pelvic pain than when you first started. So again, things to look for, making sure you're not doing Valsalva. We're trying to avoid coning. And then we also want to avoid the exacerbation of pelvic girdle pain.
Yeah, and I just think it's really important, as Cassandra just said, to stress that when you're going into keeping up with your training during pregnancy, you need to shift your mindset as well and your expectations with yourself. This is not a push it situation. This is not a how fit can I be during my pregnancy situation. This is how good can my body feel while I'm going through a pregnancy situation. Because training is not going to be the top priority now. You're growing a baby, that's the top priority. So when we're thinking about training, you also want to include cardio in there. And some of you might be runners, some of you might enjoy a regular HIIT exercise routine. So some things to consider when you're going through pregnancy. First of all, always check in with your doc to make sure that you are safe to do these exercises. There are some metabolic and blood pressure changes that happen during pregnancy that just makes these exercises not safe for you, even if you are a regular runner. So you're going to have that initial appointment with your doctor. Go ahead and ask them. Sometimes they'll tell you. But if it's a regular activity and there's no indication otherwise, you can continue on doing that. So something to consider with running is that running is an axial loading activity. And that means that while you're making that ground force impact, and when you're pounding the pavement, you're going to experience about 3 to 4 times your body weight pounding down as well. So that's going to be your added load instead of, a traditional like weightlifting scenario. You're going to get weight loaded just through your body through the axial loading. So that's 3 to 4 times. When you're considering HIIT training, that goes up to about 10 times your body weight that's going to be loading. So that's going to be a small population of women that are still able to maintain HIIT training comfortably. The other thing with running, to make it more comfortable yourself, you might want to consider shortening your strides. Shorter strides leads to less leaking. So, you should enjoy your runs. I'm a runner, and I know that if I get pregnant, I want to be able to run during my pregnancies. And to be honest with you, nobody wants to keep doing an activity where they keep peeing their pants. So you're going to want to just maybe shorter strides, pay attention to if you're having leaks, and consult with someone if that's something that's bothering you. But make the modifications that you need to make, because it is an activity that's going to affect your pelvic floor. So maybe we need to slow down our times, maybe we need to slow our cadence, shorten the stride, whatever it is that you need to do. You're going for enjoyment on these runs.
And lastly, consider just how pregnancy is going to progress. What you do in your first trimester is not going to be the same as what you do in your second, and may not be the same, or it won't be the same as what you're doing in your third. And so making sure that you are working with someone to just help modify, and also just giving your body some grace. Exercise has been proven to be beneficial towards the birthing process, and so we want to make sure that it is actually providing support and benefit to what life has for you in this moment.
And do not forget to incorporate rest, especially in that third trimester. Even taking a walk can sometimes be a little too grueling. So go ahead and give yourself rest days as you're going through your pregnancy. As Cassandra said, your plan is going to change, but include more rest as you're going through. And also, remember to hydrate.